What are the therapies that are in the pipeline now for HIV? They're going to eliminate this disease within the next two months, right?
I don't think so. But we're going to have different, more options available to us. So in other words, we've been able to go from 18 pill a day regimens taken 3 times a day with special restrictions on how they have to be taken to, in many cases, 1 or 2 pills once a day. And so we think that we've arrived and once a day dosing is where it's at. But who knows? Maybe we'll be able to push that envelope and to go once a week dosing, longer acting oral drugs, or even something very much on the horizon would be long-acting injectable drugs, where somebody could literally have an injection once a month or once every 2 months to maintain and manage their HIV.
Are these drugs actually in the pipeline now? What do we know that's coming down the road?
Yes, they are.
That's exciting.
There's a 2-drug combination that's being developed. And it may not be for everyone, and you would have to ask yourself, would you want to come and get an injection in both of your buttocks, both sides, once a month, versus taking 1 pill once a day or 2 pills once a day? And some people are going to weigh in and say, I would much rather take a pill than to have to go to my doctor every month and have to get an injection on both sides of my buttocks. And other people would say, absolutely, give me the shot.
I mean, in the cholesterol-lowering drug sphere, that's what's going on right now. Come in every 2 weeks, give you a shot, go home. You don't necessarily need pills. Maybe you would, but that's it. People opt for injections.
Right. But if your choice was to see your doctor twice a month versus once every 6 months or once every 4 months, you know, then people have to say,
Depends if you like your doctor.
Exactly.
You know, and you could argue, though, that maybe that interaction with the provider is a good thing.
Right.
And I think kind of one of the things that has been alluded to before by Elly is other things that we can bring to the table. And again, it underscores what I'm talking about with collaboration. Is rather than having an antagonistic relationship, because I really do think the payer is unique. We have claims. We know if they're taking their meds. We know if they're not. We know what other doctors they're seeing. We know what other disease states they're having, and we have nurses and pharmacists that can interact with these patients and really help the patient. So I think it's a resource that is being better utilized in other disease states that could probably be better utilized than HIV.
You know, what I get a sense of out there is because we are down to 1 or 2 pills a day, we're down to undetectable CD4 counts. We're looking at normal T4 counts. The sense of urgency, the sense of crisis, the sense of fear and panic, they're just going away. Is that a good thing, Elly?
Oh, absolutely. I think we're at a place where like I said earlier, HIV is managed and it can be controlled, and we don't necessarily need to see any new cases. I think we can significantly decrease incidence and manage prevalence.
But isn't there a risk if the sense of urgency goes down, then the sense of taking HIV for granted goes up?
You focus on other things.
And we see a spike, and suddenly this disease is back.
And it's interesting. Who are the people that we're seeing the higher rates of new infections?
Black MSM.
Young men who have sex with men, young gay men, 15 to 24 years of age. And if you think about it, a 20-year-old, they can't identify with Magic Johnson. They weren't even alive when Magic Johnson was playing basketball. They certainly don't know who Rock Hudson is. And some of the recognition that we might have with the early days of HIV, our younger population doesn't necessarily have. Maybe the education isn't there in the school systems. Maybe there's been some complacency. So I have a concern about some of our younger population where the message isn't getting out.
I mean, we can't let up our guard, can we? This is going to pop back. This virus is out there. Now, if we keep pushing it down with drugs, there's a chance on one side to eliminate it. But on the other side, you take your eye off the ball, boom, it's back. And to some degree, that's your responsibility too. You've got to continue to pay for this stuff. Yeah? I mean, you recognize that. It's only a question of how much you're willing to pay.
Yeah, right. We'll pay for the right thing. Absolutely,
Okay.
right? I mean, we want to do the right. I don't think we're coming from
Can I
this.
quote you on
Yeah,
that?
absolutely. We're not. I don't think nobody's coming. Nobody wants to say no. It's just we want to put our dollars where it makes the most sense.